Okay, good morning, students. So today, first we will discuss about the homework that I have given you, and after that we will be continuing with the chapters that what we have discussed from the last part we will be discussing. So what was the homework that I gave you all yesterday? So let's not waste time, okay? Whenever I ask something, you just keep on responding very fast. If you know the answer, no need to wait for your friends to respond. Any one of you? Okay, as no one is responding, so yes, okay, Darshana, say. What was the homework that I gave yesterday?
Estrogen of ovaries and testosterone of testes.
Estrogen and
Estrogen and testosterone.
testosterone.
Um,
Okay. Okay, you have done your homework. And then what about others? Let me ask rich person. Rich person, have you done your homework?
No, ma'am. I was
Okay.
absent, ma'am, yesterday.
Okay. What about Girija? Can you please tell me? I already gave. It's not actually no, it's not a homework because I already discussed about this in your offline class. So don't consider that it is a homework. So Girija,
yes, ma'am.
yeah, say. What is the answer? It's so, it's such a disgrace that you all don't know about this. So say it. What is the answer? If you don't know, I will pass to other. There is no issue. Shall I pass to other? There is a male and female sex hormone, right?
It is a steroid hormone. Ma'am, hello, ma'am.
Okay, can you please tell me what are the female sex hormone and what are the male sex hormones? Only that much is required, nothing else. Okay, Girija, take your time. Okay, who will tell me now? Nafisha, can you please tell me? Because we can't waste time. Nafisha?
Yes, ma'am.
Yes, say the
Progesterone
answer.
and the estrogen.
Yeah, progesterone and estrogen is what? It is the hormone of who, male or female?
Female sex hormone.
And what is the male sex hormone?
The testosterone.
Okay, Nafisha, okay. Srijana, can you please tell me what are the sex hormones that we, the male and the female, possess?
In female estrogen and progesterone, and in male testosterone.
Okay, whoever haven't written yet and whoever don't know about this sex hormone, okay, you just write it down from your friends, because now Nafichisa, Srijana and all, they have already, as Girija seems to have network issue, okay, I hope she have written it. So Nafichisa, Srijana, all this, Darshana, everyone, they have written the homework. So whoever haven't written yet, so write down the female sex hormone, that is the estrogen and progesterone, and the male sex hormone, that is the testosterone. All this, try to know it. If you don't know, it's such a disgrace. Okay, let's move on to yesterday. Okay, do you want to move on? Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay, this was what we have discussed yesterday. Okay, can you see the slides? Wait, just wait a minute. Okay, can you see the slide?
Yes, ma'am.
Yes, ma'am.
Okay. Okay, why I told you to like know about the sex hormone is that because you have got now in the chronic renal fever, if there is disturbances in your sex hormone, then obviously there will be like decrease the means the desire to have sexual intercourse will decrease, and especially for the girls that you can have a problem of amenorrhea and all now all this. That is the reason why you need to know what a female have what type of sex hormone, male have what type of sex hormone. All this you need to know. That is why I gave you all a homework. Don't forget, okay? Next time if I ask, will you be able to reply me the answer? Yes or no? See, no one is responding. Yes or no? If I ask next time, will you be able to give the answer?
Yes, ma'am.
Yes, ma'am.
Okay, let's move on. After that, we have dermatologic. So dermatologic indicate what? Dermatologic indicate what? What type of problem it is? It is the problem of the kidney, the heart, or what is this? This is derma related to what? Organ. Which organ does it relate? Pardon?
Skin, ma'am.
Yes, skin. Yes, very good. Dermatologic. So what type of like sign and symptoms you will see if a person suffer from chronic kidney disease or chronic renal failure, then what type of dermatologic problem that can be seen. So let us discuss one by one. So number one is the pallor, and number second one is the hyperpigmentations, and the third one is the pruritus, and next is the ecchymosis. So if any one of you have written any spelling mistake, so you can just slide and then correct your spelling. So what was the pallor? Everything I explained, I just want to like check your knowledge. So what was the pallor? Any one of you? When you don't respond, I need to call out the name. You know, it's so irritating. So just try to, don't wait for me to pronounce your name one by one. So just before that, always try to respond. What is pallor? What is pallor?
Pale skin.
Yes, your skin will be pale. It's very simple. Very good. Your skin will be pale. Understand? That indicate paler. So that kind of, you know, like that kind of sign and symptoms that you will see in a person. Okay, his or her skin will look very pale or pale if he suffer from chronic this renal disease. Next is hyperpigmentation. And what is hyperpigmentation? Hyperpigmentation? Hyperpigmentation, because I already explained, that's why I'm asking. Hyperpigmentation. What is hyperpigmentation? Any one of you? Okay, what is Surajit, can you please tell me what is hyperpigmentation?
Become more dark.
Yes, the skin, our skin, these patches become more this dark color, isn't it? Yes or no? Just wait a minute, okay? Let me check. Who's keeping on trying to join? Okay. Okay, there is hyperpigmentation. Okay, hyperpigmentation means darker patches or darker means spot on your skin. It's not that light. Pale, it's not pale. It's darker. Okay, dark pigmentation is being seen. डार्क पैचेस कुछ पैचेस होने से वो बहुत डार्क होगा कुछ स्पॉट कुछ अगर तुम लोगों का स्किन पे अगर कुछ स्पॉट है तो वो बहुत डार्क होगा all those dark patches dark spots that are present in the skin that relate hyperpigmentation जो pigmentation हो रहा है ना वो बहुत ज्यादा होगा that is why it is written hyperpigmentation. So are you clear about hyperpigmentation? Yes or no?
Yes, ma'am.
Yes.
Yes, ma'am.
Okay. Next is pruritus. What was pruritus? I have given the meaning also. What was that? Say the meaning that I have given you all.
Itchy skin.
Okay, it was what? Itchy skin is not it?
Yes, ma'am.
Yes, that pruritus. You can sleep. Pruritus, don't get confused. Okay, you can simply call it like your itching. Itching. हमारा स्किन में जो itching होता है ना उसको बोलते हैं pruritus. So you will face some uncomfortable, you know, like irritating sensation. Okay. So कुछ irritation सा कुछ uncomfortable sensation होगा जो तुम अपना skin को scratch करने का मन होगा. तो इची का वजह से स्क्रीन को स्क्रैच करने का मन होगा तो दैट इज नोन एज प्यूराइटस इची स्किन. इज इट क्लियर?
Yes, ma'am.
Yes,
ma'am.
Okay, next, ecchymosis. What is this ecchymosis? What is this? I already give the meaning, so just say it out. That's all.
Dark purple spot from on your skin.
What, pardon? I could not hear. Say nicely.
Dark purple spot from on your skin.
Yes, very good. It's very good. The dark purple spot na, that is formed on your skin, or simply we call it as bluish discoloration of the skin. Understand? Bluish. तो हमारे स्किन पे जब ब्लड जमा हो जाता है, अंदर से ब्लड जमा हो जाता है एक जगह पे, तो क्या होता है? It might be like purple or blue color something, ऐसा कुछ होता है ना, purple color, isn't it? Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay, that is known as ecchymosis. All these things, these are all the medical term. Okay, so try to know everything. The meaning sounds to be simple, but the medical term is like kind of hard. So, but just try to memorize it. So, okay, you are clear about dermatology, right?
Yes, ma'am.
Yes, ma'am.
Your friends are still joining. Let me wait. Okay, wait. Just. Okay, that is all about this dermatology. Okay, let's move on. What was the number 6 point that I gave you all? What was that number 6 point?
Hematologic.
Okay, next is, okay, we'll discuss this first. Neuromuscular, okay? Under neuromuscular, what type of sign and symptoms you will have? Number first point is fatigue. I don't need to explain. Fatigue, sabko pata hai. There will be a sleep disorders. So what type of sleep disorder? Sleep disorder means like you might have like insomnia. You know now what is insomnia? Ari? You know what is insomnia? Insomnia, any one of you? Ilasara, what is insomnia? INSOMNIA.
Lack of sleep or
Yes, very good. Lack of sleep or inability to sleep is not it. It means when you can't sleep at night, you used to say na, that you have insomnia. So that is sleep disorder. All these sleep disorders you can see under this neuromuscular system. So apart from that, you might also see the sign of headache, again lethargy, and then muscular irritability, and then seizure. What was the other name of seizure? My dear student, what was the name of the what is the other name of seizure?
convulsion.
Loudly, say loudly.
Convulsion.
Yes, very good.
Convulsions.
It's convulsion. So Caesar was convulsion. So it's very good, you know, like in every disease, because everything is related to kidney disease now. So all the signs and symptoms are almost same. So it's good for you all. As it is repeated, you forget, then also like you can again recall it back. So the Caesar, that is convulsion, all this also is seen under neuromuscular. And then coma. What is coma? Coma. Okay, let me ask one person. Okay, let me ask, is Samuel joining? Is Samuel joining?
Yes, ma'am.
Okay, Samuel, comma क्या है बोलो तो?
Ma'am, unconscious.
Yes, very good, Samuel. Coma means it is a state of unconsciousness. Okay, इंसान unconscious हो जाता है. So that kind of symptoms, that kind of sign and symptoms you will see. Okay, that sign comes under neuromuscular system. So every one of you clear all these: fatigue, sleep disorder, headache, lethargy, muscular irritability, seizure, coma, everything. Shall we move on?
Yes, ma'am.
Okay, next
Yes,
one.
ma'am.
नेक्स्ट इज हेमाटोलॉजिक. हेमाटोलॉजिक सुन के दिमाग में क्या आया बोलो? डर्मा सुन के ही स्किन दिमाग में आया, तो हेमाटोलॉजिक सुन के क्या आया? What comes in your mind? Say
Related to
Blood.
blood.
yes, very good. Hematologic means related to blood. It's not it. हम जब भी hematologic disease बोलती, what are hematologic disease? Hematologic disease are those disorder, you know, like that primarily affect our blood, our blood that and blood forming organs, all these. Understand? Like hematologic disease maybe. Can anyone tell me what is the like one disease of hematologic? One disease, anything.
Anemia, ma'am.
Yes, very good. Anemia. तो अगर किसी का like red blood cell कम होने से या फिर किसी का blood कम होने से उसको बोलते हैं anemia. So under this, under the hematologic system, you see the sign of anemia. Are you clear?
Yes, ma'am.
Yes.
There are lots like sickle cell anemia. All these are also there, but if you know one point, that's enough. Okay. That's number 7. Next is psychosocial function. Okay. If you haven't written yet, you write down psychosocial function. Psychosocial function. See the spelling nicely. Psychosocial function. You see the spelling nicely. Okay. Under this, in psychosocial function, do you know what is the meaning of psychosocial? It mainly relate to like the individual thoughts and behavior. Okay. Okay.
Yes, ma'am.
Okay. Okay. Okay, so psychosocial function here also, in what type of sign you will see personality and behavioral changes. So you will see the sign of personality and behavioral changes. So I think this much was the point. Was it means, okay, next is diagnostic evaluation. So let us go back to whatever point I have given under the, so number 1 was GI check. Okay, listen carefully once again. Clinical manifestation GI. After in GI, I have given all this. I won't repeat again. And what was number 2? Number 2 was cardiovascular. And then number 3 was respiratory. Under that क्या क्या आता है अच्छी तरह पढ़ना. Or number 4 में metabolic. This I have given. Then study this nicely. And then number 5 was dermatology. And then number 6 was neuromuscular. And then number 7 was hematology. And then number 8 was psychosocial function. So try to by heart all these things, okay? And I think I have given you all 2 diagnostic evaluation, isn't it? And I told you all you can study anyone, isn't it? Yes or no?
Yes, ma'am.
Yes, so diagnostic evaluation I have given you all 2, okay? Actually, I have got 2 books, okay? In that 2 books, there are like an extra diagnostic evaluation is also added. So like if you want to study, it depends on you. So this was the first diagnostic evaluation that I have given you all, that is complete this blood count, that is CBC, then elevated serum creatinine, decrease. And I was thinking that you all might find a little bit difficulty in like memorizing this diagnostic evaluation. So I prefer you all to study this diagnostic evaluation. I think I gave this, isn't it? If not, write it down. I think I gave it, if I'm not wrong. Ishan, did I give this diagnostic evaluation? Bishal, did I give this diagnostic evaluation?
Yes, ma'am.
Okay, okay, then all of you. See nicely, okay, diagnostic evaluation. And next time, if you all don't respond now, I won't give the slide anymore. Instead, I will let you on all the video and then we will discuss in that way. I think that will be the better way. So diagnostic evaluation. In diagnostic evaluation, what we get is that chronic renal failure is diagnosed by the observation of a combination of symptoms and elevated BUN and creatinine level. So the following abnormalities found in the blood may signal CRF, that is chronic renal failure. So this chronic renal failure, understand what does this mean is that it can be diagnosed just by the observation, that is by the combination of all the symptoms, because just now I have given you all like 8 or 9 symptoms I have given you. So if all those combination symptoms, all those symptoms means like you might see all those symptoms together, or 1 or 2 symptoms might be seen in a person. So if all those kind of symptoms is seen, as well as if there is elevated of BUN and creatinine level, so in that case you can also diagnose that a person have chronic renal failure. So let us see the following abnormalities that are found in the blood with signal CRF. So one by BUN. What was the full form of BUN? Don't tell me you don't know. What was the Shital? What is BUN? Is Shital present or absent?
Blood urea creatinine.
BUN. Only B. B का क्या है? B.
Blood
U.
urea
N.
nitrogen.
Yes, blood urea नाइट्रोजन. ओके, अगर ब्लड यूरिया नाइट्रोजन का लेवल हाई हुआ या फिर क्रेटिनिन लेवल हाई हुआ, और फिर जो सिम्टम्स मैंने दिया था, बहुत ज्यादा सिम्टम्स दिया था सिस्टम वाइज, वो सब सिम्टम्स दिखाई दिया, तो यू कैन लाइक सिग्नल और सिग्निफाई दैट अ पर्सन हैव chronic renal failure. So let us discuss one by one. So one is anemia. So if you find that if a person have anemia, understand? So anemia, that is low level of RBC, red blood cell. So if you find this, then you can suggest that he might suffer from this chronic kidney disease. So, and next is hypocalcemia. What was hypocalcemia? I have given every meaning of that. Hypocalcemia.
Low blood level of calcium.
Low blood level of calcium. Is it correct? Other students?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, let's move on. What is hyperphosphatemia? See the spelling, okay? See your copy. If it is wrong, write nicely. Hyperphosphatemia. Hyperphosphatemia.
High level of phosphorus.
What is hyperphosphatemia?
High level of phosphorus.
High blood level of phosphorus.
Phosphate in the where? In the blood, isn't it? Yes or no?
Yes, ma'am.
Okay, let's move on.
Yes,
Next.
ma'am.
Okay, next is hyperkalemia. What was hyperkalemia?
High blood level of potassium.
Of potassium.
Kalemia means what? High level of calcium or high level of potassium?
Potassium.
Potassium.
Okay, good. Next, hyponatremia. Natremia, ये क्या था? What was hyponatremia?
Low level of blood
Sodium.
Low level of, जोर से बोलो, low level of
sodium.
sodium. Okay, okay, low level of sodium. Okay, natremia. Natremia means sodium, okay? Okay, next, low blood level of bicarbonate. And then the other one was low plasma pH, that is blood acidity. This the plasma ka level be low hoga. All these are the, like if all these abnormalities, if it is found in the blood, then this can signal chronic renal failure, okay? So this is how you can like diagnose chronic renal failure, and it is very much means easy as compared to the previous diagnostic criteria or the investigation that I have given you all. So is it clear about diagnostic evaluation?
Yes.
Yes, ma'am.
Okay.
Yeah.
Okay. So coming to the next is the management. So next is management. So what was the first management that I have given you all? Tomorrow I will discuss about the pathophysiology management. So the treatment of chronic renal failure may include dietary therapy. So अगर किसी का chronic renal failure हुआ तो उसको like क्या dietary therapy suggest करोगी या क्या dietary therapy prescribe करोगी, such as low protein diet in order to limit the accumulation of end product of protein metabolism that the kidney cannot excrete. So because as our kidney cannot excrete, isn't it? Because chronic renal failure, end stage renal disease means what? When your kidney is like totally damaged, it's not it. So obviously there will be like effect in the like excretion. So as the kidney cannot excrete, so what will happen is that there will be accumulation of end product. There is the accumulation of waste product of protein metabolism. Okay. So in order to remove all this accumulation of end product of protein metabolism, in order to remove all this accumulation, what type of dietary therapy that you need to suggest is, you need to suggest the low protein diet. Is it clear, or I will repeat? Is it clear?
Yeah.
Clear, ma'am.
Yes, ma'am.
Okay. Let's move on. So next, if you have seen that it was in the clinical manifestation also now, or in the diagnostic also you have seen hyperkalemia. So in order to treat hyperkalemia and fluid imbalance, dialysis may be performed. तो अगर किसी का hyperkalemia हुआ या फिर किसी का fluid imbalance हुआ, that is intake output, all this, if there is imbalance, then what you need to suggest is that you need to suggest the patient to perform for or to undergo dialysis. So Srijana, please take attendance. Okay, coming to the next is the drug therapy is commonly implemented as well. Okay, like even though the kidney, there is total damage in the kidney, but still some drug therapy are commonly implemented. Okay, for hoping the better treatment. So some drug therapy are implemented. So to mobilize fluid that cause edema. Okay, loop diuretic. तो अगर हमारा शरीर पे edema हुआ, तो edema means accumulation of fluid in our body, is not it? तो कैसा type का medicine suggest करना है? That day also I asked. बोलो. Say. It's already in the screen.
Diuretic, ma'am.
Yes, edema. अगर
Classic.
yes, diuretic. Okay, diuretic suggest करना है. अगर suddenly तुम्हारा शरीर पे पूरा फूल गया, तुम्हारा शरीर पूरा फूल गया, your hand, your face, your leg, कहीं जगह पे भी फूल गया बहुत सारा, तुम्हारा एडिमा हुआ, तो डॉक्टर तुमको कैसा टाइप का मेडिसिन सजेस्ट करेगा? लूप डाययूरेटिक. Understand? In order to free you from edema, they need to suggest. And what are the like name of the drugs that comes under loop diuretic? Those are furosemide. So the other name is Lecce, and as well as cardiac glycoside. So the cardiac glycoside bhi deta hai. So in order to in order to treat this edema. So what are the example of cardiac glycoside? Such as digoxin. Understand? तो दूसरा नाम है जो like that is mainly used to treat edema is also like digoxin. So you write down this line nicely. The drug therapy is commonly implemented to mobilize fluid that cause edema. Loop diuretics such as furosemide and cardiac glycosides such as digoxin are used. So don't forget this. पहले का जैसा मत बोलना कि एडिमा को रिमूव करने के लिए हमको एंटीबायोटिक देना है. All those don't get confused. So next is एंटीएमेटिक. एंटीएमेटिक क्या के लिए देते थे? उस दिन भी बोला था एंटीएमेटिक ड्रग.
Nausea, vomiting.
Yes, very good. nausea, anti-emetic drugs are given to relieve nausea and vomiting. And then famotidine, spelling अच्छी तरह देखना, every one of you. See your copy if you have written any mistake. Famotidine or ranitidine, these are the name of the drug that decrease gastric irritation. And methyl cellulose, this methyl cellulose also don't write separately, it's together, okay? And methyl cellulose also prevent constipation. So इसमें नंबर 4 पॉइंट में हमको क्या क्या मिला, नाउजिया और वोमिटिंग किसी का होने से एंटी एमेटिक ड्रग देना है. एंड देन अगर किसी का गैस्ट्रिक इरिटेशन है तो फेमोटिडिन और रेनिटिडिन ड्रग्स देना है. And actually there are lots and lots of drugs, it's not it, but the only thing is that I have written here only few. And then apart from that, in order to prevent the constipation, so methyl cellulose is given. So are you clear with number 4 point?
Yes.
Yes,
Yes,
ma'am.
ma'am.
Okay, see the spelling nicely. Exam में गलत मत लिखना. Okay, for itching, क्योंकि हम लोगों को like you have seen ना in the clinical manifestation in dermatology, pruritus दिखाई दिया था ना, itchy skin. So for itching that accompanies chronic renal failure, anti-pruritic such as trimiprazine or diphenhydramine are prescribed. तो अगर किसी का chronic renal failure का वजह से, see that is chronic kidney disease का वजह से अगर pruritus that is itching skin में अगर itching हुआ तो उसको कैसा टाइप का ड्रग प्रेस्क्राइब करना है. The type of drugs are anti-pruritics, that is trimiprazine or diphenhydramine. तो ये सब ड्रग है. अच्छी तरह स्पेलिंग दिखना. All this itching होने से क्या देना है, गैस्ट्रिक इरिटेशन होने से क्या देना है, कंस्टिपेशन होने से क्या देना है, और फिर वोमिटिंग होने से क्या देना है, all this. अगर किसी का एडिमा हुआ तो क्या देना है, all these things. अगर accumulation of end product of protein metabolism होना है तो low protein या high protein देना है, all these things you need to know. Are you clear?
Yes, ma'am.
Yes,
Yes,
ma'am.
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 Okay, next was surgery, is not it? Isn't it? I think I give surgery.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. So next was surgery, and after surgery I give complication now, and I give only one complication, that was death, isn't it?
Yes, ma'am.
Yes, ma'am.
Okay, so surgery, like I have not make a slide on surgery because everyone knows that what is the surgery. Okay, everyone know the meaning of surgery. पता है ना सबको? Yes or no?
Yes, ma'am.
या फिर पहली बार सुना है? You know now what is surgery?
Yes, ma'am.
Yes, ma'am.
Okay, so kidney transplantation is also known as renal transplantation. Okay, then kidney transplant surgery is a procedure of curing the patients with end stage of renal disease. So अगर end stage renal disease का मतलब क्या है, जो disease ये बहुत ज़्यादा chronic हो गया ना, chronic kidney disease, हमारा जो kidney है बहुत ज़्यादा खराब हो चुका है, it can't function anymore. So that in order to bring the kidney into normal function again, what you need to do is that some people they transplant the kidney through surgery. Okay, so to kidney transplant करते हैं. So तो kidney transplant करने से क्या होगा, that will help the patient in curing his or her disease. तो kidney transplantation करते हैं. And then a kidney transplant is a surgical procedure in which a kidney is removed from person. तो kidney transplant क्या था? तो kidney transplant means एक surgical procedure है जहाँ पे when a kidney is removed from person, that is donor, a kidney removed from person and placed into the body of the person who is suffering from renal failure. तो किसी like healthy इंसान से kidney transplant करेगा, and then that kidney the kidney that is transplanted from the donor will be like received by that person who is infected. Okay, that who is suffering from renal failure, that is the recipient. जो देता है उसको donor बोलते हैं और जो kidney receive करता है उसको बोलते हैं recipient. So in this way the kidney transplantation is being done. So this surgery, that is kidney transplantation, this is for some case it is very, very much helpful, and it can bring back the life of a person. So there is one like Hollywood celebrity, it's not jiska kidney transplant हुआ था. Who was that? She's a girl. She's very beautiful. She's a singer.
Selena Gomez.
Yeah, Selena Gomez. उसका kidney पूरा like वो खराब हो गया था ना, and then her friend donated her kidney to her, and with that kidney only, with her friend kidney, she could survive now. So that is that means this kidney transplantation, this surgery is also performed in her. So, and the complication is death. Okay, the complication that may also occur. So that is all about chronic renal failure, and the only thing that is left is the this pathophysiology, which I will be explaining you all tomorrow. So are you clear about everything? Everything?
Yes, ma'am.
Okay, Srijana, are you done with the attendance?
Yes, ma'am.
Okay, okay. Anyone want to ask any question? 1 minute left. Yes or no? If no, we will end the class.
No, ma'am. No, ma'am.
Okay, then that's all for today. Okay, thank you, everyone.
Thank you, ma'am.
Thank you, ma'am.